Good afternoon, and welcome to our panel presentation this afternoon, The Right to Choose and the Broader Attack on Rights. I'm Cara Hendrickson, the Executive Director of BPI. BPI is an independent public interest law and policy center where we address compelling racial and social justice issues that impact the Chicago region and the state of Illinois. Through our advocacy, we work to drive racial, social, and economic justice through a focus on police accountability, reform of the criminal legal system, housing and community development, and education and early learning. To work towards systemic change, to make systems more equitable, we collaborate with community partners to ensure that those living in under-resourced communities have access to life opportunities. We believe that sharing information within our community and staying abreast of all the issues that contribute to pervasive structural inequities is essential to this work, which is why we created Building Public Interest, this series that sets out to inform, educate, and activate a wide and diverse audience around issues of social justice, racial equity, and their inherent intersection with other areas of concern that impact us all. We take our inspiration for this intersectional approach from American civil rights activist Audre Lorde, who famously said, "There is no such thing as a single issue struggle because we do not live single issue lives." At the heart of our work at BPI and of the movement of which we are a part is liberation. It is our vision that all people have the right and opportunity to live their fullest life free of systemic barriers. And that is what we're talking about today. Earlier this month, Politico released the Supreme Court's draft opinion in Dobbs versus Jackson Women's Health Organization that, if published, would overturn Roe versus Wade, the landmark case that mandated the right to abortion in America. This has already led to multiple states severely limiting access to abortions. As a woman who has never known this country without safe and legal abortion, I am deeply concerned about the future of our most vulnerable neighbors if the Supreme Court overturns Roe as projected. Women are the foundation of our movements and the backbones of our communities. Let's make no mistake, while the threat to safe and legal abortion impacts everyone in the country, its impact on low-income women, on trans and non-binary people, and on women of color would be even more extreme. Women of color are less likely to have access to contraceptive care or reproductive services compared to white women. They're more likely to be uninsured and also more likely to be incarcerated without proper maternal health care. Black women are nearly 4 times more likely to suffer a pregnancy-related death versus white women. For trans and non-binary people of color, curbing access to abortion care could result in dire consequences for their physical and mental health, as well as limited access to gender-affirming care. What is more, because we have this unusual situation in which we can actually read and study a draft Supreme Court opinion, we know that the seeds to a broader threat to other rights and protections are also buried in the court's reasoning. So as we discuss reproductive rights today, we discuss the threat to bodily autonomy. We're talking about fundamental threats to liberation, fundamental threats to human dignity, and threats to the vision of all people having the right to lead their fullest lives. I can think of no better group than our panel today to help us navigate this challenging conversation. Before we turn it over to our host and moderator and our panelists, a word of housekeeping today. We will make time later in the presentation for question and answer from the audience. We encourage you to be engaged in this conversation by adding your questions using the Q&A feature at the bottom of your screen. So at any point, add your questions there and we'll work through as many of them as we can before the panel closes today. First, I want to start by introducing our moderator today, my colleague, Loren Jones. Loren Jones serves as staff counsel at BPI with a focus on police accountability. Her work includes a focus on community oversight of policing and of reimagining effective strategies for creating authentic public safety for all communities. She also provides legal, policy, and technical advice to amplify advocacy efforts by organizations and coalitions. Prior to joining BPI, Loren worked at Dvorak Law Offices, where she represented victims of police misconduct. In that role, she litigated or managed civil rights, criminal defense, criminal appeals, expungement, and personal injury cases in state and federal court. Loren graduated cum laude from the University of Illinois College of Law. There, she received the Wickett Award for Excellence in Service and the Student Leadership Award for her work in student organizations and clinical law programs. In these programs, she helped indigent clients from a wide range of backgrounds, including incarcerated people, domestic violence survivors, and recent immigrants. During law school, Loren also externed with the Illinois House of Representatives, where her work included criminal legislation. And at the People's Law Office, Loren worked to represent people victimized by the Chicago Police Department's officers, including those working under the authority of John Burge. I'll also give you a hint. Here's one thing I've learned about working with Loren directly. She asks very good questions. So with that, I'm pleased to turn it over to Loren.
Good afternoon, everyone. Cara always says I ask good questions, but mostly she says I ask tough questions. And I know that our panel today will be able to handle all of those questions with grace and ease. And I'd like to start by introducing the first member of our panel, Felicia Davis Blakley, who is the president and CEO of Chicago Foundation for Women, an organization that works to invest in the economic security, health, and safety of women. In her position, Felicia leads the foundation's strategic efforts to invest in women, girls, transgender, and gender non-binary people as catalysts for the fight for gender equality and to build stronger communities for everyone. In September 2021, under her leadership, the Chicago's Foundation for Women launched the Shecovery Initiative, a commitment to raise over $11 million to ensure women and their families emerge from the pandemic stronger than ever. Before joining CFW, Felicia held diverse executive positions in Chicago city government, including the inaugural executive director for the mayor's Office of Public Engagement, commissioner, and deputy mayor for public safety. Additionally, Felicia has served on several civic and charitable boards, including Governor J.B. Pritzker's gubernatorial inauguration committee. She was an appointee to the Illinois Senate Sexual Discrimination, Harassment, Awareness, and Prevention Task Force, a member of the board at Regents at Mercy Home, also a board member at the Partnership for College Completion, and that's only to name a few. Our second panel member, Julie Hamos, is the Senior Advisor on Medicaid Coordination at the Office of Medicaid Innovation, where she is responsible for expert analysis, development, and implementation of Medicaid behavioral health transformation and interagency coordination. Julie has served on the Planned Parenthood of Illinois Board of Directors for the past 7 years, and for a number of years prior to her service as a state representative. Early in her career, Julie served as a legislative counsel and a policy advisor at the Cook County State's Attorney's Office. In that position, she advocated for some of the first ever laws and policies on domestic violence and sexual assault. In 1984, she was appointed to be the director of the Child Support Division, overseeing over 300,000 child support cases. From 1999 to 2010, Julie served as a Democratic member of the Illinois House of Representatives, representing the diverse Chicago area 18th District. In 2010, she was appointed to be the new director of the Illinois Department of Healthcare and Family Services. And during her tenure at HFS, Illinois' largest state agency, she guided the expansion of managed care in Illinois Medicaid programs. Our final panelist, Carolyn Shapiro, is the founder and co-director of Chicago Kent's Institute on the Supreme Court of the United States and an associate professor of law at Chicago Kent College of Law. Her scholarship is largely focused on the Supreme Court, which is very topical for today, its relationship to other courts and institutions, and its role in our constitutional democracy. She teaches classes in legislation and statutory interpretation, constitutional law, employment law, etc. And from 2014 to 2016, she served as the Illinois Solicitor General, and in that role argued cases in the Supreme Court, the Seventh Circuit, the Illinois Supreme Court, and Illinois appellate courts. Prior to starting her work at Chicago Kent Law School, she handled plaintiff civil rights cases. She was also a Skadden Fellow with the National Center on Poverty Law and clerked with then Chief Richard A. Posner of the U.S. Court of Appeals for the Seventh Circuit, and also clerked for Justice Stephen Breyer of the United States Supreme Court. Professor Shapiro is a regular contributor to iSCOTUS Now blog, which she also co-edits, the Chicago Kent faculty blog, and she's also contributed to the Huffington Post, the American Constitutional Society blog, and commented on a number of media outlets, including Washington Monthly, CNN, and Chicago Tonight. Welcome to all our esteemed panelists. We're so excited to have you here to have this important conversation on our right to access reproductive care in America. My first question for you all grounds this conversation in something that is personal and intimate to a lot of people. And for me, the right to abortion is a deeply personal issue. What was your reaction when you heard the news about the draft opinion? And was this something you had been anticipating? And we can start off with Felicia here.
Hi, Lauren. Thank you for inviting me into this conversation, and BPI for hosting this important conversation. So when I first heard, I guess I was stunned a little bit. I was shocked, partly because in recent history, the Supreme Court, including those who were nominated, really talked about that they were not going to undo Roe. Like they said that, including Kavanaugh, right? Like that's not what we're doing. It's the settled law of the land. And how quickly, like this leaked opinion, like how quickly that changed. So in some ways felt that the American people had been, they had been dishonest. But on the other hand, I will say, looking at the legislation that's been coming out of some states, going back to 2021, hundreds of bills that were coming out of state legislatures around, there were anti-abortion bills, different, formats, even early, so far in 2022, even before this, over 300 bills, and they are as horrible as in Missouri, not allowing a woman to address an ectopic pregnancy, which is deadly and not a viable pregnancy. And so just looking at what this actually means, like the sum total of what this means for women's health, for women's bodily autonomy, it's very scary.
Thank you. Carolyn, would you like to share your answer to that question as well?
Sure. I have to say I was incredibly distressed, but I was not surprised. I thought that the language that the justices used in their confirmation hearings was deliberately not a promise. It was a description of the state of the law at the time, and that the conservative legal movement had been working towards this for at least 40 years, if not longer. Not quite since Roe was decided, but shortly after. So I was not surprised. I was surprised that it was leaked. That is unprecedented, and I have many thoughts about that, which I can share as we go further. In terms of other reactions, and I know we'll be talking about this later, I have obviously, in addition to the deep concerns for what this means for women's equality and autonomy, I think there are significant risks with respect to other rights as well, that if this draft becomes the final version of the opinion.
Yeah, and we'll definitely get into those issues a little bit deeper. Julie, did you want to share your initial reaction to the draft opinion?
I have been anticipating this since we elected an anti-choice president in 2016. So that was not a huge surprise. And that was even before we knew that one president would be able to have 3 appointments in a 4-year term. And as Felicia pointed out, it does feel like the senators who voted on those appointments were duped. But yes, we were all duped. However, even anticipating it, I was shocked in reading the words. We must rule, we must say that Roe and Casey must be overruled. The radical nature in the scope was really a shock. Supreme Court, I think Carolyn would know this better than I, tend to be more moderate as issues evolve. I think that's probably what Justice Roberts was trying to do behind the scenes. But yes, I would say I was shocked, and all of the sort of the emotions that we've talked about here today.
Yeah, I think even when having the indicators of it coming, it's still, the blow is something that it's indescribable. I do want to turn it over to Carolyn to give us a quick explanation in layman's terms, our expert on the Supreme Court, of the legal grounds for overturning Roe v. Wade that are set out in that draft opinion.
So the draft opinion, and starts from by discussing the reality that the Constitution contains both enumerated rights and that is things that are express, and by and large those are things that are listed in the Bill of Rights, like the freedom of speech, etc. But the court has over many years consistently and repeatedly recognized what it sometimes calls unenumerated rights, that is, rights that are not explicit, but that nonetheless are understood to be essential to what sometimes is called ordered liberty. This goes back to cases involving parents' right to raise their children as they see fit. For example, parents' rights to decide where their children go to school, whether they go to a private school or a public school. Those are some of the earlier cases involving this idea of unenumerated rights. Those cases date from the early 20th century. But the idea of unenumerated rights actually, as a matter of constitutional text, goes back to the founding. The Ninth Amendment makes clear that not every right that we hold is written into the Constitution. And in fact, one of the reasons some people at the founding opposed a Bill of Rights was that they were worried about exactly that. If we have a list, some people will think that something that's not on the list is not a right, and that's not what we want to say. So how do we decide what are unenumerated rights? There are different schools of thought about how one goes about this. In general, there has been I think it's possible to describe the development of unenumerated rights as a relatively incremental process where the court recognizes things that the type of autonomy and privacy interests that are essential to living in our world and that build on each other. So for example, we have cases that recognize the significance of the choice of how you raise your children. There are cases that then recognize the right to marry who you choose, the right to decide when and whether to have children in terms of access to contraception, the right to refuse medical care, and the bodily autonomy that goes along with that. But the court has resisted finding rights that it is sometimes asked to find, like, for example, the right to assisted suicide. The formulation that Justice Alito uses to describe how we decide when there's an unenumerated right is deeply rooted in our history and traditions. And he goes back to the founding to talk about his version of history as to whether women had access to abortion legally at the founding, or a right to abortion at the founding. Now, it turns out actually women did at common law have the right to abortion, or put another way, abortion was not criminalized until at least up until quickening, when the woman can feel, or the pregnant person can feel the fetus move, which is around halfway through the pregnancy, or even a little later, excuse me. But Justice Alito, by using this formulation, deeply rooted in history and tradition, is able to ignore these other cases, this development of case law around privacy and autonomy, and instead look back. And he focuses a lot more on what the law was in the 1868 when the 14th Amendment was enacted, because that's the amendment in which we find the right to privacy that supports Roe versus Wade. So he says Roe was wrong, that there was never such a right to abortion. It's not deeply rooted in our history and tradition, and we have to undo it.
Thank you for that explanation. And we're going to get into the impacts of his language in that opinion a little bit later, and what that the effects that may have on other rights. But could you also, and I know you got into the draft opinion a little bit and the fact that it was leaked and the significance of that. Could you talk about whether this draft opinion is something that's set in stone? We know that the opinion is likely to be released at the end of the term in June or July, and also the significance of it being leaked.
Yeah, so I'll start with the last point. The significance of it being leaked is, you can think about it in a number of different ways. First of all, it is astonishing that it happened. While we've had leaks about deliberations in the past, and some leaks related to how a case might come out, we've never had a leak of a draft opinion of this nature. Apparently, the Roe versus Wade opinion itself was leaked, but only a few hours before it actually issued, and it wasn't actually released to the public. The press held off, but it wasn't a draft. It was the final. So what does it mean that it's a draft? What happens at the Supreme Court is, after oral argument, the justices go into a room and they vote. At least they take what you might call a straw poll as to how they think a case should come out. And more or less, they might say a little bit about what reasoning they would endorse. Whoever the senior justice in the majority is, which would be the Chief Justice if he's in the majority, or whoever the senior justice is if it's not the chief, in this case, undoubtedly Justice Thomas, then assigns the opinion, the majority opinion, to somebody in the majority. That justice then goes and writes a draft. And to say it's a draft doesn't mean that it is a rough draft. It is a pretty fully formed opinion that is then circulated to all of the other justices. And that's the point at which a lot of discussion can happen there, and sometimes changes are made. The changes theoretically can be as dramatic as justices changing their mind about the outcome, and that does occasionally happen. So it occasionally happens that a majority opinion becomes a dissent. I do not think that is going to happen in this case. I should be clear. It occasionally happens that a majority opinion becomes a plurality, which is slightly more likely in this instance. And by that, I mean there might be, say, 3 or 4 justices who stay with Justice Alito, including him, saying that Roe should be overruled, but there would be other justices, notably probably Chief Justice Roberts, and another 1 or 2 who would say, we're not going to go that far. We are going to uphold the Mississippi law. That's technically the law at issue here, which outlaws pregnancy starting at 15 weeks, but not expressly overrule Roe. So there's going to be, and there is undoubtedly already, discussion inside the court. Some of that discussion is public to the whole inter-court. That is, memos go between chambers that are circulated to all of the other chambers. The leaks we're hearing suggest that, at least as of a week or 2 ago, there hadn't been any separate opinions, no concurrence, no dissents circulated. Of course, I don't know what's happened since then, but my speculation is that there's a lot of discussion that is more bilateral in between, or that is not being sent to the full court between justices. I can say a word about why I think it leaked. Of course, and I want to start out by saying this is pure speculation. I am not saying this is what happened. But I think it is most logical to me that the person who leaked it did so for strategic reasons. And those strategic reasons make more sense to me coming from the right. Because once the draft leaked and it was clearly written as a majority opinion with the expectation that at least 5 justices would join, there was the kind of protests we've seen around the country that was completely predictable, that any justice who might have been wavering and thinking about doing something short of joining this opinion might feel a lot of pressure to stick with the opinion so it wouldn't look like they were caving to the protesters. So I'll stop there.
That's interesting because I thought the opposite, but that also makes sense. So the speculation continues.
And we may never know.
We may never know, exactly. I wanted to ask a broader question to Felicia and Julie. Why is the right to safe and legal abortions important to the broader fight for equity? And I'll pass it to Felicia first and then Julie.
Loren, thank you. This is a really important question. I mean, and some of it has to do with any conversation about Roe versus Wade and access, any conversation about the challenges, you can't have those without also discussing the intersection of poverty, education, access, racism, and the multifaceted health disparities that still continue to plague women in our communities, but particularly women of color. Most notably, right, the New York Times did an article recently about who gets an abortion, right? Someone who's the typical patient is someone who's already a mother. She's in her late 20s. She's attended some college, has low income, is unmarried, and is in her first 6 weeks of pregnancy. These things are really important. The part that she's already a mother and she already has low income are really important because, and if we continue down this road and force women to bring to term children who they have set themselves, you know, these aren't easy decisions. This is a painful decision. And so some people don't really understand how hard this is, how gut-wrenching these decisions can be. They could be health-related decisions, they could be economic decisions, or there could be something in the way of some criminal behavior or something that has caused trauma and the pregnancy. And so the fact that these factors are already there, and the evidence already shows that if she were forced to have this child, she and the new baby and pre-existing children would go further into poverty. And so we cannot uncouple all of those things, right? We can't uncouple the economic impact, and we certainly cannot decouple like the lens that race plays in this whole conversation. The truth of the matter is, and we know this to be true from the 70s and before, women of means, and typically this has been for white women of means, they can go anywhere to get a safe abortion, legal or otherwise. Women who are not of means, and I recently attended a screening of The Janes, which is streaming right now, about the underground network in Chicago, these desperate women who were secretly seeking out abortion services. But the most scary part of that documentary was the whole ward at Cook County Hospital that was dedicated to septic abortions, which means that women were harming themselves and there was nothing that the medical establishment could do for them.
Thank you, Felicia. And Julie, did you want to add to that as well?
Well, yes, I think Felicia kind of said it all. I do want to say I'm the oldest one on this panel. I was in college before we had Roe. So this is not hypothetical with me at all. I mean, I knew I had friends who came from families with means, and I had friends who came from families who couldn't afford it. And the girls who got pregnant, in our case where I was living, flew to New York, they took care of it, and they had a safe, legal abortion in New York. And it was really the other girls who were resorting to back alley abortions and sometimes harmed themselves, or who were forced into an unwanted motherhood. And so this really is the future. I think it's already happening with so many states that have restricted access to abortions. This is a huge equity issue. This will further exacerbate the income equality in this country. And this is just the beginning of seeing that really emerge.
That leads me to my next question. I was going to ask you, Julie, what the difference, or hypothetically now, what the difference will be if Roe was overturned compared to what it was before, what the situation in this country was before we had Roe. Do you see any differences there?
I do. You know, we have seen some changes in I think in technology and also in science. We now have medication abortions. Over 50% of abortions are by the abortion pill. And, you know, the problem is the abortion pill is only for abortions that are under 11 weeks, so early pregnancies. We also have telehealth. So it's possible to have a consultation through your computer with an abortion provider and then have the pills sent by mail. Again, this works for early pregnancies, but it will make it possible to help women in other states without forcing them to travel. So that is until the politicians figure out a way to restrict that as well. For women choosing to have surgical procedures or who are in their later second trimester pregnancy, it will become more challenging to find available clinic slots. This is a time-sensitive procedure, so we know that the relatively few remaining clinics in friendly states will have a large demand for services. They will have to expand hours and locations. And the second trimester, you know, in our experience, the girls, and especially I think young women and women who are in their second trimester are even more desperate to find affordable and available abortion clinics. What we currently don't have, and Felicia talked about this, is the Jane Collective, that underground net abortion service. I think that will reemerge in some of these states. It will have to. Women are not going back to pre-Roe. I think in Illinois, we will also have to recreate some form of Jane to protect abortion doctors from right-wing zealots who will want to do them harm. So again, we have to really build out a whole new set of services, availability, and I think underground work in all 50 states.
Thank you, Julie. And yeah, that's an important point. I wanted to circle back to what Felicia was describing as far as the populations who will be most negatively impacted by the lack of safe access to abortion. And could you talk a little bit about how that might change in the present day if Roe is overturned, how the population may grow, or who will be maybe groups that we're not thinking about as well that will be negatively impacted?
Yeah, so there are some other considerations I think for us to think about, and one of them, so what for women of color, and I don't know that things are better, so I will say this, unfortunately, because you asked, I think how are things might be different, is that in many instances, I mean, if you look at the Illinois Department of Public Health statistics, if you look nationally at the Centers for Disease Control, the CDC stats on this, women of color, particularly Black women, at a higher rate of risk of death from pregnancy and or pregnancy related complications. So here we have a situation where in some cases actually carrying a child to term or being forced to kill, if you cut off any avenues to get a safe legal abortion and you're forced to carry a term, you're actually also now endangering the lives. And we have to be honest about what our healthcare system looks like right now. And that's right now. And so those stats haven't gotten much better. In fact, we're one of the, we have some of the worst statistics on maternal health for a country of our wealth. And it is something that can absolutely be addressed with the political will. The other thing that I don't think we're considering is that for people and who have had difficulty getting pregnancy and have, the science has evolved, and Julie touched on like how science has evolved. We didn't have in vitro fertilization prior to Roe. And I've read a lot of reports, like some people have said how this has allowed in vitro to Roe, the fact that Roe was the settled law has allowed in vitro to continue. What now happens with the embryos that have been fertilized as part of an in vitro process? This is and I'm not a legal scholar, I'm not a lawyer, but this is very scary territory, because now the way in which couples address embryos could become a criminal act as well. And if this leaked opinion and we continue to go down this road, and the conversation about when, what protections are entitled to an embryo versus what protections are provided to a woman and her right to bodily autonomy. So unfortunately, there are still a lot of other, just on the health side, considerations that we're not really talking about.
Yeah, I think that's really important. To add on to that, specifically, Illinois is one of the few states in the Midwest that has a law that guarantees individuals' rights to make decisions about their reproductive health care, including birth control and abortions. It makes it a safe haven for surrounding states like Indiana, Missouri, Kentucky, Wisconsin, and Iowa that have indicated they may severely limit or ban abortions post-Roe. How can Illinois prepare for the influx of out-of-state patients? What barriers, legal or otherwise, might healthcare providers or potential patients face when seeking to help people coming to Illinois for abortions? And I think we touched on this a little bit, but I want to throw that question to Julie.
Yes, I'm on the Planned Parenthood board, and we have been preparing this for the past 4 years. During the pandemic, we opened a new clinic in Waukegan in Lake County, so to make it more geographically accessible for pregnant women coming in from Wisconsin. We are currently building out our Champaign clinic to make it more accessible for pregnant women coming in from Indiana. We are teamed up with our sister Planned Parenthood affiliate in St. Louis, which has built a new clinic on the Illinois side. So we are prepared, and the influx of out-of-state patients has already begun. However, we haven't seen yet all the laws that these hostile states will enact to impose punishments on people or to deter them from trying in the first place, such as criminal prosecutions. We're hearing about some of that already. Bounty laws like Texas, the new feature of many of these laws that are passing, the one in Oklahoma just signed today or yesterday, they will try to clamp down on the women, the doctors, on mail order abortion pills. I don't think we have the imagination to dream up what evil they're going to concoct. But I think that's what the Supreme Court has opened, the floodgates to all that kind of evil thinking, in my mind.
Felicia, did you want to add on to that as well?
Yeah, I also wanted to add, so in Illinois, this has already had a chilling effect. So let's just be clear. Roe is the settled law of the right now. It is still law, and in many places, women still have access to safe and legal abortions. However, ever since this conversation started, even when Texas initiated its law, and then Mississippi has the similar law, which is the case that's before the Supreme Court now. We were a member of we also joined in an amicus brief for that case and some other related cases. But because of this conversation, it has had a chilling effect. So a lot of women who are sitting in states right now where abortion is still legal are already fearful of exercising their right to a safe, legal abortion. They're already afraid. So even before the leaked opinion, states like Illinois, where we have the leadership that said, we trust women full stop, to decide for themselves and their families what it is that they want and their bodies. And so states like Illinois have already seen, we know that we've already seen an increase of persons coming to Illinois to seek those services. And to be clear, because the foundation, this is an issue that we fund and support. I had already visited some Planned Parenthood clinics on the far south side where women were already coming in and other places from across the borders, whether they were coming in from Indiana or whether they were coming in from Missouri and or to the south, right, when I've gone on these visits. And this is long before this. So we know that this was already something that was happening. But with the increase in those services, right, and let's just be clear, the women I just went over, like who is a typical patient, low income, that means this person already is living on the margins. This person is already, any small thing, any tremor in their financial situation could make it untenable. Sometimes it means, if they're late for their rent or now can't pay the rent and now they're facing eviction, or perhaps they have to miss a car payment and now they have to, they risk their car being repossessed. The economic impact can't be stressed enough, because the travel that it takes, already in some of these states, our friends down in Memphis at Memphis Choice report, women have to come, then they have to come back, 48 hours later. That's a lot on a woman, and that costs something. And so I think the thing that I don't know the magnitude, and I think that we're trying to think about this, is what does that look like from an economic standpoint? How could we possibly, meaning the state, how could we possibly meet the demand of the women, should this leaked opinion become true, new settled law? How can Illinois possibly stand up and meet the moment and be able to support the women, additional numbers of women who will come to our state looking for safe legal abortion?
Thank you. And I think adding to what Julie said as well, like we need all hands on deck and these networks of people to be in support. And we're going to ask you all later how people listening can get involved and support this as well. Carolyn, Justice Alito stated in his draft opinion that the decision should not be understood to cast doubt on precedents that do not concern abortion. I know you talked about some of the underlying case law that helped to inform Roe. Is this a statement that we should find comfort in? And how could this draft opinion impact other constitutional rights, such as the right to same-sex marriage, interracial marriage, and the future of access to contraception?
We should not be comforted. I'll start there. It's at best disingenuous. It's comparable to what was people said at their confirmation hearings. Whether or not ultimately those other rights are endangered by the Supreme Court, or are those cases recognizing those rights are overruled, is going to be a function of a lot of things, including what happens in states that oppose same-sex, where the powers that are in control oppose same-sex marriage, or the right to have sexual relations with someone of the same sex. If those states start doing things to undermine the opinions recognizing those rights, and there are lots of different things they might do, then those issues will come back to the Supreme Court. So I take no comfort from that statement at all. I think that we know from as recently as 2020 that Justice Alito, and I believe it was Justice Thomas, were complaining even at that point about Obergefell, the case that recognized same-sex marriage. Justice Alito expressly lists a whole range of cases, that including some that I already mentioned, when he describes the right of privacy, which is this unenumerated right from which that Roe rested on. And he says it's not in the Constitution. So he sort of talks out of both sides of his mouth, I would say, in this opinion. On the one hand, he says the this right to privacy is illegitimate. It's not in the Constitution. And then he names all these cases up to and including Obergefell. Later, he says, well, this opinion isn't about those cases, and abortion is different because of the concern for fetal life, which does not exist in those other cases. But again, that is not reassuring to me. I read that opinion or the draft as an invitation to states and officials to do things like refuse to issue marriage licenses, refuse to put the names of same-sex spouses on a birth certificate, things like that, that currently, under current Supreme Court precedent, they can't do. But I think I am not remotely reassured by that language in this opinion.
Thank you, Carolyn. Although my heart it's heavy. I did want to lift up a few questions that we got that Felicia so graciously answered in the chat, just so that everyone can get access to that information as well. So someone asked, relative to the abortion pill, does the delivery of the pill become an illegal act as well? And Felicia answered yes, potentially, depending on the state and the laws that might come forward. And a similar question was asked about traveling to seek an abortion and returning home post-procedure. What could the penalties of the law be? And again, paraphrasing that, I think it depends on the state's laws and how they choose to enforce them in the future, which what I'm getting from you all is still a little up in the air. Felicia, did you want to expand or Julia?
And so this to me is really scary because one of the things most women, low-income women, are going to be driving, right? They're not necessarily going to be able to afford an air flight to go. They're going to be driving. Somebody's going to go with them to help them. And what makes me so nervous about it, especially around the kind of like bounty hunter type of provisions, are that how vulnerable you are, driving across, state lines. It makes me think of, not barricades or roadblocks per se, but certainly, depending on the state, if you're crossing a border and they stop you, and I just can't imagine the potential. I'm sure the potential abuses that can happen here. So that's the scariest part to me, is that think about a young girl who's, a young woman who's 19 and in college, and she's driving to Illinois from another state perhaps, and how scared she is already just to do the act. And then the fear of if she gets stopped by the police in the state, and questioned about her intent. The other thing that I've heard a lot about are the tools that we all have on our phones right now for tracking, period trackers and fertility trackers, all kinds of trackers. And there's been a lot of conversation about how easy would it be for law enforcement to access those records. And so there's a lot here. There's a lot here for us to be concerned about, the ways in which other privacy and other rights might be violated or diminished.
In a shocking way. I mean, this is a world that we can't even fathom, where we're going to stop cars, we're going to go to we're going to send police or somebody to people's mailboxes to see if they got pills that day, abortion pills in the mail. I mean, this is truly the Handmaid's Tale future that we can't even envision. I hope that we're going to talk about political action soon, because that's like where I'm coming from. If we let that happen, it is not America that we know.
I'll just jump in with just the constitutional law professor angle, which is that there are an enormous number of open questions about what ultimately might be struck down and what might not be. The question of whether a state can criminalize conduct by its own residents that takes place in another state. Can they criminalize planning to go to the other state, even if they don't criminalize that conduct? Can they criminalize helping somebody plan to go to this other state? These are big questions that we don't have clear legal answers to.
Thank you. And to echo what Julie said, we got a question that said it feels as if we are living in a growing nightmare, a real life version of A Handmaid's Tale. And I will say I had to stop watching A Handmaid's Tale because it was just hitting too close to home. And on that note, I would like to give all the panelists an opportunity to recommend some ways that people can support, get involved, take part in political action. And Julie, I'll let you head off because I know you're ready.
Yes, I am so ready to lead or follow the revolution. But okay, first of all, we do need to support the various funds that have been created and are in existence right now that help pregnant girls and women to access abortions, including with travel funds. This is the way that we can really make sure that income inequality that we have been talking about this whole time and the equity issues are somewhat mollified. So there are those funds, we need to support those. But I believe the important strategy will really come down to political action. You know, people need to support pro-choice candidates. Elections really do have consequences. Now, I think what really is going to be different is that in the post-Roe world, much of the political focus will be, and will need to be, at the state and local level. That will be the true impact of the Supreme Court decision. There will be organizations that spring up, I believe this, to help find, support, and elect pro-choice candidates up and down the ballot. Illinois was not always pro-choice. It was the work of organizations like Personal PAC and Planned Parenthood Action, which got pro-choice candidates elected one at a time and got anti-choice candidates defeated. That model now needs to be exported to other states, and there's work going on to do that. Those PACs will need to be supported by all of us, financial contributions, our volunteer energy, but really nothing will change until people who support women's reproductive rights mobilize and change the politics of this nation.
I want to jump in too and say, so listen, Julie made a very important point. The Hyde Amendment came out of Illinois Representative Henry Hyde, and it was a prohibition on allowing Medicaid to pay for abortion, which also had all kinds of other health-related consequences. And so if we think for a minute that, I have to do nothing and I am going to be fine, my daughters are going to be fine, my nieces and every woman that I love is going to be fine, you cannot. This is not the time to sit back and to say, I'm sure everything will work itself out. I think the very viability of women's economic future is at risk here. I have been talking about COVID and the impact of COVID on women's economic security and mobility. I know that before COVID started, women had just outpaced. There were more women in the workforce in the United States than men for the first time in our history. That is a significant watershed moment, and we have lost all of that due to the impact of COVID-19. And I am saying if women are forced to carry babies to term that they cannot afford or that present health or other economic consequences for them, we're only going to see a further erosions of their abilities. And so this isn't safe. And this is not a time to rest on our laurels. This is a time for all of our sisters to come together and say, I need to vote. This is my interest, not only for the state, and Julie said it, up and down the ballot, which means who are we sending to Congress? Who are we sending to that is important as well. Who are you sending to the Senate? That is important as well. What we have seen, the Supreme Court nominations matter. If you didn't think that they matter, we wouldn't be here right now. It matters, and who votes on those. What we have seen right now is that the ability for even a pro-choice president or a pro-choice, it's limited if we do not have representatives to actually support that president as well. And so pro-choice is a really important moment. And it's important for all of us to rally our friends and to get out there and to vote our interests. I say this is the number one interest that I have above so many other things that I care about, because this impacts me personally and it impacts the future of women.
So that's a tough act to follow. But I'll just add a few more thoughts that have to do with the realities and the way in which those realities might affect political organizing. When you asked me about other rights, Loren, and I talked about same-sex marriage and the right to sexual intimacy, I didn't talk about contraception, but the right to contraception is in this long line of cases that Justice Alito points to as arising from this, what he considers illegitimate right to privacy. And to the extent that he is saying that that abortion is different because of this concern for fetal life, I see no reason to take any comfort in that when it comes to forms of contraception that some people describe as abortifacients. That is, forms of contraception that might prevent, like IUDs, that prevent a fertilized egg from implanting in a uterus. There are people who are opposed to those as a religious matter. They consider that tantamount to abortion. And I don't think that anything in that opinion would protect women's rights to access effective, high quality contraception. So that's an important, I think people don't understand that. Similarly, I think there could easily be, I think it was Felicia talked about IVF, there could be significant impacts on people's ability to use IVF as a method of dealing with problems with fertility and surrogacy for people who want to have use a pregnancy surrogate or who need to for whatever reason, and the ways in which the consequences of overruling Roe could lead to deep intrusions in people's privacy. We've already heard about some of them. I'll just add one more. Every miscarriage is a potential crime scene in a state where abortion is illegal. That is horrifying if you think about what that could mean. So those ideas, I don't think these are far-fetched. These are not. These could happen. These will happen in some states. Some of the states are already passing laws that would have the effect of outlawing certain forms of contraception or are introducing those laws into their legislatures. So we need to understand the depth of what's at stake here when we get ready to go out and become politically engaged.
And I think just to add on a final note, maybe, because we're trying to end on a positive note, I think looking at what Carolyn just said, the possibility of a broad coalition of partners is really what the upshot of all that is. So we shouldn't think narrowly about this. This will impact potentially a lot of different folks out there who care about many diverse issues that all are impacted by this one decision.
Thank you, Julie. Thank you to all our panelists. This issue impacts everyone, and I'm really happy we're all here to share your information and knowledge as well as be personal with us. I really appreciate it. And I will pass it to Cara just to wrap us up.
Thank you, Loren. Thank you to all of our panelists. Wow. We're talking about a world we can't even fathom, a growing nightmare. My heart is heavy too, Loren, having had this conversation. We're nervous, we're scared, we're angry, but we are not alone. Julie, I want to lift up your point about building a community. I would really encourage everyone who is with us this afternoon. I hope you've been taking notes from this amazing panel about what you can do to be engaged. As Felicia said, to be voting, to be acting, to be motivated. This is our call to action today. And I hope you'll also add to your list to be engaged with us as we build the public interest on this issue and we work to build community. Join us on June 7th. Join us for our next Building Public Interest series, where we'll be talking about the new Chicago Inspector General's work. There's lots of work ahead of us here as a community, and we hope to be engaged with you in all of it. Thank you again to our panelists, and thank you to everyone who has joined us this afternoon.